Hello, everybody. Welcome to Cat Talk Radio. I'm your host, Molly DeVos. Today, we're going to talk about feline wellness with Dr. Brian Hurley, the medical director of AmeriVet Veterinary Partners. But before we jump into that, we actually have a follow-up question from last month's episode about dental. And before we jump into that, let's welcome Dr. Hurley to the show. Thanks for being with us today.
Hi, I'm glad to be back.
I know our listeners really appreciate these segments and you being on, and so much so we're getting some really good questions, and I want to read this one because I think it's an excellent follow-up question about dental. And Angelina says, "Hi, Molly. First, I want to say that I love your podcast. As a veterinary assistant student, it really helps to keep me engaged in my studies. I do have a question regarding the last dental episode where you talked about periodontal disease and stomatitis, though this may be an old wives' tale, as my grandma was the one who told me this. But I was wondering about the effects of repeated general anesthesia in cats. My grandma told me it can have negative effects on human health, and I'm curious about whether it has the same effect on cats. My 1.5-year-old cat, Jida Marie, was diagnosed with juvenile periodontal disease, and I've been using the water additive in her static bowl. I worry it could be pointless in her cat-tit fountain, as it has a filter, in addition to brushing her teeth every few days. However, I would love to get her in for some cleanings to be sure it doesn't become a lifelong condition for her, but my only concern is the use of repeated anesthesia potentially causing issues for her in other areas." I thought that was a great question.
Oh, it's a great question.
Yeah. What do you think about that?
So, my take on anesthesia is obviously there are always the inherent risks of anesthetic complications, right, including death, but they're so minimal in our pets and even in people. So I think the most important thing to consider is working with your veterinarian first and foremost. If their physicals are normal, their blood work is normal, they're healthy, there's no indication of underlying disease, I wouldn't be afraid of anesthesia, particularly knowing that teeth can be a source of kidney problems and heart issues down the road if the teeth get really bad. So I wouldn't necessarily shy away from it. My cat lived to 16 years of age. I did a dental in him every single year under anesthesia because I couldn't clean his teeth. He wouldn't take the water additive. So I took that risk of anesthesia to make sure his dental health was good. And so I wouldn't shy away from it. I don't think, as long as you're working with your veterinarian, I think veterinarians are also very good during those annual exams. They don't feel that a dental is necessary, they're not going to necessarily recommend one. So just work closely with your veterinarian. And if they feel a dental is needed, by all means, I would not be afraid of it.
And I think, I remember my grandmother saying this too, and this could just be an era thing, but that it wasn't like you're going to die under anesthesia, but that every time you go under anesthesia, you lose some brain cells. And so you didn't want to go, very frequently. Is that an old wives' tale, and has it just gotten better? Or
I think the anesthetics have gotten a lot better. We also are very cognizant of pain management. We'll do other medications pre-operatively so we can minimize the need of excess anesthesia. And so because we've gotten so much better at it, I think the procedures have gotten a lot safer.
Okay, good. All right, there you have it, Angelina. Take your cat and get the dental done, especially if it's been diagnosed with juvenile periodontal type stuff. Yeah, I think it's important to get that cat on a regular regime, as we said in that episode. And thanks for reaching out. And anybody else listening that has questions for Dr. Hurley, absolutely send them to me. You can email them to me, Molly at cattalkradio.com. we would love to hear them. So today we're going to talk about feline wellness in general. And I want to start with how do you select a vet? Is there something that people should look for? How does one go about doing that? And of course, I should say that preface this, these podcasts have a long shelf life, and somebody might be listening to this 5 years after we record it. But at this particular time, there's a vet shortage, and sometimes just finding a vet that will take you and you can actually get into is a huge challenge. But assuming we didn't have those issues, what do you recommend for aligning with a vet?
My biggest recommendation for aligning with a veterinarian is let's assume you have multiple choices in your area. It would be family recommendations, friend recommendations, but ultimately also going and visiting the veterinarian if you don't have a relationship with a veterinarian, and talk with them, meet with them. What's their personality like? Take a pet with you and see how they interact with the pet. So you get that feeling of comfort that this is going to be a good match for you, because, let's face it, we all look for different things in our veterinarian, and the way I treat one owner, I can treat a second owner identical. And, I just shared this the other day. One client will only see me after that visit, and the other one would prefer to see one of the other veterinarians. But I was the same person, and so you just have to work with them. I'm also a big advocate, particularly when you're going through the kitten regimen. Most practices will have a standard protocol for kittens and dogs and things like that. And what's important is also meet the other veterinarians in the practice, because ultimately, when an emergency occurs, you may not get to see the vet that you're usually seeing, and so you won't be meeting that vet for the first time in a very intense appointment.
Yeah.
When you're scared, I mean, it's hard to also be working with somebody you've just never met.
And are they good about, like, if somebody were to just call and say, hey, I just want to come by and meet you between appointments, can we just, without my pet, but can we chat in the hall? Or are you suggesting that you make an actual appointment with the different vets in the practice?
I think it's good. It's going to be practice by practice. Some practices may want you to set up an appointment, but I think it's money well spent, because you're really trying to set up the success of your pet and you with the veterinarian of your choice. And so I don't think it's a bad expense, because this hopefully will be a lifelong relationship that you'll have with this veterinarian. But some practices, I've had owners walk in, set up an appointment, and then all of a sudden my staff will go, oh, there's the one that you're going to be seeing. And so I'll stop and I'll chat with them real quick, just in the hallway.
Yeah. Here, sadly, in our community, there is such a vet shortage. There's only one clinic you can actually really get into, and they won't allow you to make appointments. It's like an urgent care. It's show up and wait in line, and you get to see whoever's available at that moment that your number comes up. It's kind of sad that it's degenerated to that.
Yeah, and like you said, right now, that's the unfortunate thing is, demand is high and vets are low. So
Yeah.
you're absolutely right. But in that ideal world, if that can happen, that's a way I've always told owners. It's a great way to meet a veterinarian. If in this day and age, if you take them and you just don't get that warm and fuzzy feeling after the appointment, and somebody else will see you, there's always that opportunity too.
Right. Now let's talk about kittens. You were mentioning kittens. Kittens so assuming someone adopts a kitten, typically if you're going to adopt it from a shelter, it's already going to have its boosters and things like that. But let's say it doesn't. What are some of those kitten boosters that they need early in life?
So, typically speaking, when we're seeing kittens for the first time and there's no vaccine history. Now, I'm going to preface all this with, you will work with your veterinarian because we will customize recommendations to the individual patient based on lifestyle, risk of disease processes, things like that. But normally speaking, what we'll be looking at is we'll be looking at giving a 2 to 3 shot series of feline panleukopenia, the chlamydia virus, and also the herpes virus or calicivirus, which is kind of an all-in-one booster shot.
And is that what we see is called FVCRP?
Yes.
Okay.
So that is definitely the initials that you will see oftentimes appear on the on the invoice. We also start them with rabies in the course of that first year, as well. Typically starts off as a 1-year rabies vaccination. And then leukemia becomes an interesting vaccine because if you kind of follow the feline practitioners' guidelines for leukemia, one of the things they start talking about is, you test them at that when you see them, and then you go ahead and do the series that first year. The concept is this: everybody says that their kitten is going to be indoors. And then they'll come back and you'll find out that for whatever reason, they're sneaking out or now they're outside. And so you've protected them, knowing that they were hopefully negative on that test. You've protected them against the leukemia virus. Now, if they truly stay indoors, and at that first year, they're like, nope, they're going to be indoors the rest of their life, there's no risk. You don't continue that leukemia vaccine.
So the leukemia vaccine is an annual thing. It's not a one and done.
There's annual, and there's also one that will last 2 years. So a lot of work has been done in vaccinations. And again, this is why it's so important to go to the veterinarian at least once a year, because we need to discuss what's happening in the area and make sure that we're following a good vaccination protocol, because your FVCRP can be given every 3 years in a lot of instances, at this stage. There are other vaccines that are adjuvant free that need to be given every year. And so it's just working with your veterinarian and discussing their vaccination protocols and their recommendations for your pet.
Yeah. And so I had a veterinarian recommend to me recently to do an FVCRP vaccination on Pico because I'm in the shelter so frequently and, could be carrying some of those viruses and stuff home with me. Is that making logical sense too?
That's logical sense because, again, it's always about lifestyle and risk of exposure.
Yeah.
And so we have to weigh everything in coming up. It's not just a one size fits all. And, and we're veterinarians and we all have our comfort level of what we want to recommend. And so there's that at play as well. And so that's why you have to have those discussions and get into, the office to stay up to date with the current recommendations. If there were an outbreak in the area, we would know about that, and we might change the frequency because the risk has just gone up significantly. And so we want to make sure we're protecting our cats.
Yeah. Yeah. And is it like the flu shot where the cat might exhibit some illness symptoms, get a runny nose, have some virus symptoms? Is it actually like a live virus vaccine where they can have some symptoms after?
There are some modified live components, like the rabies vaccine is a killed vaccine. Typically speaking, I always tell owners when I was in practice, vaccines we hope could be 100%, but we know better that really in life, nothing's 100% guaranteed. Well, except, maybe that we're all going to die at some point.
Right.
But, there are vaccines like the panleukopenia vaccine. We don't see that disease much anymore. And the vaccine is very highly effective at preventing that disease. Where when you're talking about the herpes and calicivirus, what we hope to achieve is if they get sick, that the symptoms and the rate at which they resolve those infections is much faster in a vaccinated kitten or adult cat than say an unvaccinated, where they could get pretty severe symptoms.
Yeah, that makes sense. Another thing that you're going to want to do when you get a new kitten is obviously, I get some identification on it, because if it gets out, to your point, and sneaks out or gets out of the house, darts out a door or something, you want somebody to be able to call you and say, I've found your kitten. What do you recommend is the best type of identification method?
Well, I think the traditional method in a situation like that, where they're just getting out and you're just hoping whoever finds them, is going to pick up the phone and call you, would be just your traditional collar and tag. I'm always a big fan of making sure that if you're putting a collar on your cat and they're going to sneak outdoors, you want a collar that will break away if it gets caught on something, because that's definitely could be an issue with cats and climb trees and be around limbs and things like that. I think that's probably the better. Now they're coming out with GPS collars where you can locate them yourself. So that's another mechanism. And then the biggest one that somebody can't take off or throw away or hide from you would be the microchip. I'm still a big fan of microchipping, mainly because when we get pets from the shelters or we get stray cats that come in, the protocol at our hospital always was you scan them, see if there's a chip, and then hopefully we can reunite a cat with a cat owner that way. And every once in a while we do. Sometimes there's no client affiliated with that microchip because they've decided not to register too, but at least it's another way that we can hopefully get them back home if they get lost.
Yeah, absolutely. And it's funny, I've seen a lot of x-rays come across Facebook recently with the microchips migrating down into the legs and things like that.
Yeah, they definitely can, migrate. So you do have to scan the entire body. The mechanism really is supposed to be, when you do it, it generates a little reaction. So they develop some tissue around it to kind of hold it in place. But
that's probably another good thing to ask your vet at the annual visit, though, is, scan, let's make sure the microchip is still up in the shoulder area where it's supposed to be, right?
Absolutely. It never hurts. I mean, it's a quick process to just make sure not only is it where it should be, but that it's also functional.
Yeah.
I have seen them stop transmitting the number, so we can't pick the number up. And so all of a sudden it's a defective microchip. Doesn't mean that we're going to go in and remove it. It just means that, obviously it's not going to be a good source of being able to relocate your cat or locate your cat.
Right. Which is so important. Now, we mentioned briefly feline leukemia and FIV, and I know, I'm so familiar with that, of course, in a shelter setting, because we do that combo test for FeLV and FIV, and a lot of shelters have just stopped because there's so many false positives and things like that. What do you think, though, in terms of a private practice, should I be getting Pico, FeLV, FIV tested now that he's an adult? I know he had one as a kitten before I adopted him and it was negative, but is that something I should keep doing?
I have read that just like heartworm testing in our canine patients, we recommend it on an annual basis. If you have an outdoor cat, you could make the argument that they should be tested annually, because you want to be surveying in the event that there was either one, a break in the vaccine, or two, if they're an outdoor cat and the owner elected not to do the leukemia shot, that they haven't gotten infected. I think in reality and in general practice, usually what happens is we'll test them early. To your point of false negatives, or false positives, definitely happens. And so coming out of a shelter, I will always recommend retesting if the shelter did it, even if, if they come in and say it was positive, or if they say it's negative, because there can be a law. And usually I'll do it about 4 to 6 weeks down the road. Sometimes I've done as much as 6 months just to make sure that they are either positive or negative. So as far as, I think that's going to be the discussion with the veterinarian again, and what their belief process is as far as the testing goes. We always will test if they're exhibiting symptoms, and we want to rule that out as a possibility too. So we're doing it more diagnostically, even if they have leukemia shots, even if we know they've tested negative in the past, we're going to, if it's on the list, we're going to test for it.
Yeah.
We don't want to miss something that we could easily diagnose in the practice.
Yeah. It's not been something that I have done with Pico because he's indoors only. I mean, if he has a catio, and when he's outside, he's with us on a leash. So it's not like he's going to be fighting. He's neutered, right. So he's not going to be mating. So he's not going to really, and neither of those diseases are transmitted, casually. So I haven't really done that. I also am slow to get him rabies vaccinated because he's, again, not outside. He's not in contact with other animals at all, wild or domestic. So, and it's not something I can bring in off my shoe,
Right. The only thing I'll say about rabies, since you brought that up, is, that one is the one that is required by law.
Right.
And so that's the main reason. How everything else that that we do from a vaccination wellness point of view truly is optional, highly recommended, but optional. So if a client says, no, I don't want that FVCRP, then we'll try to educate them, but we can't force them to do it. With rabies, we're bound by law. That not only are we bound by law to give it, as pet owners, you're bound
by your city ordinance,
because it's more of a risk, because it's fatal. It puts the human population at risk. And so that's the one they don't mess around with. And, there are really strict guidelines on how you handle a cat, particularly cats, because they tend to go out and love to get in fights. Is we always have to figure out their rabies status, and then figure out, are they going under a 6-month quarantine because they're unvaccinated? Are they going under a 45-day quarantine because we just want to observe them and make sure they didn't get rabies from whatever bit them? And so that's the one where I would even encourage you to keep your vaccine up to date.
Yeah, he turns 3 on Monday, and he had a 3-year vaccine. So this next time we go, we need to do that. And I do think I'll get him FECRP vaccinated at the same time. Like I said, I'm around so many cats in the shelter and potentially bringing home stuff. So,
right. And it was interesting too, because I last week was at the Western Veterinary Conference, and I sat in, partly I tend to try to pick topics that, if I have a case that I'm struggling with and there's a lecture pertaining to that, I will go sit in on it. This time I decided to go sit into hot topics in feline medicine.
Oh, good.
Because of this show, I wanted to see if there were any pearls I could pick up. And the veterinarian that was giving the lecture years ago, I mean, he's been on every board, vaccination boards, and all these other boards, just very well respected in the industry. And he was talking about years ago, he could almost be considered anti-vaccine because risks, and fibrosarcomas is something you'll hear about. Cats that get vaccinated can develop these fibrosarcomas. And when he was talking this time, he's now pro-vaccine. You know, it used to be that about 1 out of every 10,000 cats might develop a fibrosarcoma, and he was saying more recent data is showing about 1 in 16 to 20,000. So he's not afraid of vaccines anymore. And so that was just kind of a unique thing to hear, because, you know, you always hear it on, even on the kid side, you know, the fear of vaccines and what vaccines can cause. And
Yeah.
but we also have to always remember, absolutely, they may cause an issue in some, but without them, just imagine if they got the disease that we can easily prevent and it ends up being fatal. So, you know, and that's where talking with your veterinarian and coming up with a good plan really is important.
Yeah. Now, what about deworming? Is that something that we should be doing preventatively, or do we wait until there's an issue before we do it? There's so many over-the-counter worm medications and stuff. How do we know what to do with that?
Right. So as far as deworming in our feline patients go, you know, as kittens, we're going to go put them through a regimen as kittens, just prophylactically. We want to make sure that we're clearing anything out that they may be carrying, because fecals are not going to be 100% effective at finding an egg per se.
Mhm.
With our dogs, we use heartworm preventatives that deworm them on a monthly basis, and depending on the product that you use, depends on what internal parasite is treated. In our cats, cats are unique. One is we don't routinely, though, again, there's advocates out there that say we should be giving our cats heartworm medication, just like we do our dogs on a monthly basis, and therefore they would be getting dewormed. But in our cats, what we tend to see is if they're strictly indoors, we recommend checking a fecal every year at the annual. If we're not seeing anything, we're not deworming. If we see something, or at any time over the course of the year, they were to exhibit any diarrhea or anything like that, we would probably check, deworm as needed, not just prophylactically. Our outdoor cats, however, at our practice, we used to recommend deworming them quarterly if they were outdoors, just
Hmm.
because we might not ever get a stool sample from them. Tapeworms are pretty common in our feline patients, not only from fleas, but also because they hunt. And so we have to take that into account. So again, lifestyle
Yeah.
could, you know, could help us determine what that appropriate recommendation is.
Yeah. I don't even think I've ever had a vet do a fecal examination on my adult cats. Always my foster kittens, because they're either got Giardia or Coccidia or something like that. But never on an adult cat. Just as a routine visit, have I ever had a vet do a fecal sample.
You know, if you go to the CDC, roundworms, for instance, they are contagious to us. Now, again, it is not a common thing that we do see, but think about when you have kids, young kids in the family who are infamous for going out or playing, they could play in the litter box and then they're not washing their hands and all of a sudden the hands are going in their mouth. So we do it to make sure that we're also protecting
Yeah.
the human side as well. And that's, we kind of follow the CDC guideline on, stool samples. And in our kennel, we will recommend dogs having it twice a year because, again, we don't want them spreading it to all the other dogs in our kennel because there will be playtime and things like that. And, dogs like to smell around and things like that. Cats definitely are managed a little differently when it comes to internal parasites, but it's always a good idea to test once a year, I think.
Yeah. Yeah. And what about those parasites that we're talking about, fleas, ticks, things like that, and all the diseases that they carry? We should be using flea and tick meds on our cats, even if they're indoor cats.
I recommend every cat should have flea and tick. You just never know what the exposure could be, how, if the fleas get in. really, if you think about flea and tick preventative, you're really giving it to prevent ever having a problem. Sometimes the only way we get owners to use the product is after the problem's there. And we may never fully get fleas under control again, or ticks. Ticks can come in on us, ticks spread disease. The best way to kill them, if the tick goes and wants to take a meal off the pet, the preventative kills it. So now that tick doesn't end up on us taking a meal and spreading disease. So I think it's a really important thing. The reason we also advocate, some veterinarians may advocate for heartworm preventive in cats, is cats are capable of getting heartworm. The problem is, think about the size of their heart. Cats don't usually have a high worm burden because they're not the primary host for the ones the heartworm want. But that heart's so small, even one or two long adult heartworm can really create an issue. And the other thing that we that we have going against us in cats is we have no treatment for heartworm in cats.
Right.
It's hard to diagnose. We can't treat it. And so we have to hope that they outlive the heartworm, and that the heartworm in the process of dying off doesn't create complications in them. And so again, that's why you may hear your vet talk to you about heartworm. And I'll guarantee if you're in an area where somebody has seen a high level of heartworm in cats, I know they'll be recommending it.
Yeah.
But we don't necessarily follow the same process in cats as strongly as we do in the canines, because that's where it's more prevalent.
Sure. And they're outside more, theoretically. What do you think about the, like I use cedar oil and lemongrass oil and or diatomaceous earth on Pico? What do you think about those as compared to the other prescription?
People anecdotally have successes with those, and usually what I'll say is, if you're not seeing, if they're appearing to be successful, it may be just that you don't have any issues around. So if you were ever to start to see a flea or start to see external parasites, that would be the time to go, oh, maybe I need to try something different.
Right.
But like I said, they definitely have a place. I'm not one to say don't try those things, because there have been successes using those.
Yeah.
Not everybody wants to always put product or give medication to their pets, though all these medications are safe. But just like when you're watching TV, everything has a list of side effects this long.
Right.
But they have to do that for knowledge base, so the owner makes a informed decision when they're starting to use a medication.
Yeah. Yeah. Thankfully, we live in a dry climate, so we don't see a whole lot of fleas and ticks. So
Right.
it's not as much of an issue here. So what else about, I want to talk about spay and neuter. That's another thing that, when you get a new kitten, or if you've adopted a cat, people have that choice. Obviously, if you're adopting from a shelter or a rescue, the animal's already going to come spayed or neutered. But, are spaying and neutering something you generally recommend? And what are the risks of not doing it, and I hear a lot of vets say wait till 6 months, because again, in the shelters, like Pico was neutered at 8 weeks of age. They wait till they're 2 pounds. But a lot of vets will say wait till 6 months, wait for them to get their hormones before we take them away. And you hear, well, if you don't do it, you're going to get pyometria, the females. What are the real risks associated with doing it and not doing it? And is that something that's generally recommended?
So 100% spay neuter is recommended across the board by veterinarians. There's very little instance where I would say I would never recommend spaying and neutering at a young age. Matter of fact, I had a consult yesterday from a friend. They called because their veterinarian is going to do a surgery because now their pet has what they're assuming is testicular cancer. And and it's pretty large, and the estimate was on the higher side. And so we even talked about this is why we do it young, because we can eliminate those type of issues. 5 to 6 months is generally when we would recommend as well in our cats, partly because we're watching them grow. We want to make sure everything's okay. We want to have a couple of examinations on them when they're young. We want to make sure their vaccines are complete before we take them to surgery. But we understand that we can do it in shelters. Shelters' main thing is they want to make sure that that cat isn't going to later generate a bunch more kittens that are going to be coming back into the shelter.
Exactly.
And so, for those reasons, it's good. The reason we really want to do it, besides just, population control in some instances, is, when we spay and neuter, there are studies out there that say that their longevity is longer if they're spayed neutered. Partly why that occurs is because they're less likely to want to roam. If they're going to roam, they're going to be outside. If they have their hormones, they're going to want to fight. They're going to get themselves into potential trouble. And so we're taking away some of those risks. As far as medically goes, we can eliminate ovarian cancers. We can, eliminate the pyometra that you spoke about. We can, when you spay them before they start, going into their cycle, you can affect the risk of developing mammary cancer in our pets. And so it doesn't mean that they won't get it, but when you compare the populations, the population that keeps the hormones and starts cycling is going to have a far greater risk of developing mammary cancer at some point in their life, which can be a pretty major undertaking and surgery if you have to do that. And so I think those are some of the reasons. Pyometra, really, we see it. What happens is when the cervix opens, bacteria gets to ascend in there. When that cervix closes back down, infection can occur, and that can be life-threatening. When you have this two tubes in the abdomen, they're full of infection, that can be devastating, to the patients. And that surgery is considered an emergency surgery. And we also run the risk of, when you're trying to get this massive swollen uterus out that's full of pus, the last thing you want is to rupture as you're trying to bring it out, because it's very there's a high risk that it could rupture on you. And so it's not a surgery that we really like to do, and we can prevent it by spaying and neutering.
Yeah, absolutely. And what about blood testing? Right? How frequently do you recommend that a cat get blood tests done in their vet visits?
We recommend once a year. They're aging faster than we are. There's plenty of charts out there. It's not necessarily 7 years to every 1 year, just like this linearly. It does kind of taper a little bit, but we do know they're aging a little faster. The idea behind it is we want to look at blood work every year, because what we're looking for is incremental changes in the blood work that may clue us in early to be able to do an intervention and change some things that could slow down the progress of, say, a kidney disease, for instance, or, if the liver values are going off. And so it really gives us the ability to try to catch things earlier, because in one of our earlier episodes, if you remember, 75% of kidney function needs to be gone before the blood's going to show it.
Right.
And if we're in chronic kidney disease, I only have 25% of kidney left to last as long as we possibly can. So imagine if I saw indication early on that would allow me to do it. And I've also seen where I've looked at blood work in some of my young patients, and the values are high. And so I start tracking it. And what it taught me is there are a small amount of pets out there that their normal is a little on the high side in some of these values. And so when you're watching the blood work, you can start making that determination too, because that would be really important to know. because we had a good friend that had a young dog, and I had, I saw high kidney values, and so I watched it for a year, and then I sent it to the specialist, and they're like, it's fine, this is normal for this dog, because nothing else was showing kidney. But if that dog was older and I did it, I would have been starting all forms of kidney treatments,
Right.
thinking, oh my God, your dog has kidney disease, and it could have been normal.
Yeah.
So that's
Yeah.
why we do it. And so, I think because medicine has gotten so good, our pets are living longer. And I think a lot of veterinarians are practicing preventative blood work every year, just like our doctors do when we go in every year.
Exactly. And I always hate to compare cats to people, especially, especially in a behavior realm, right?
Right. No,
But
absolutely.
in a medical realm, it sounds like we're a lot more similar. We need those, as we talked about in our last episode, we need those at least annual dental cleanings and annual checkups and annual blood work. I do that on Pico. I got a baseline when he was 6 months old, and we do it every year just to make sure.
Yeah. Everything that we try to recommend is the sole purpose is try to keep our pets with their, pet family as long as we can.
Yeah.
And we have the medicine to do that. We just need to be able to identify it as quick as we can, particularly in cats, because as we've talked about before, cats are infamous for waiting until the very end to show us that they're even sick. And so
Yeah.
if we're not doing something proactively, we're going to lose that battle 100% of the time. And it's no one's fault. It's just, that's the nature of cats, is they're very good at hiding until they can't hide anymore. And then usually it's a little too late.
Yeah, absolutely. Anything else you can think of in terms of feline wellness and general wellness that we haven't touched on yet today?
I think we've covered a lot today. I think
Yeah.
it can be pretty overwhelming, and I think as we end this conversation, the most important thing is, while we covered a lot, your veterinarian is going to talk to you about your individual cats, and they're going to formulate a game plan based on your lifestyle, your cat's environment. And so they may not do some of the things we talked about, or they may do everything and then some. But those visits also allow them to talk about your favorite thing, which is behaviors. We're asking a lot of questions, just trying to make sure that we're doing everything in our power to keep their pets with them. And again, while we know cats, it's tough sometimes to get them to the veterinarian.
Yeah.
I'll reiterate, like we have every show, just make sure you talk to your veterinarian, because there's a lot of things being done now to help reduce that stress for
Yeah.
not only your cat, but also for you as a cat owner, so we can do all these things that we talked about.
Yeah, absolutely. And we should do that. We'll talk about doing a show on the actual vet visit in cats too. That would be good.
Absolutely. I mean, that'd be a great topic. Just walk them through an exam,
Yeah. Yeah.
and
Good.
what the veterinarian's looking for when, you know, when they're looking at the eyes and listening to the chest and feeling the abdomen.
Mm-hmm.
I think that'd be a good show as well.
Good. And anybody out there listening that has any ideas for medical topics for Dr. Hurley and I to talk about, be sure to email them to me at molly@cattalkradio.com. Thank you again for being on our show.
Oh, you're welcome. I was just going to say too, if you do start getting a lot of questions, we could always, if there's enough, we could always do a show just on,
Yeah,
taking questions. I mean, obviously it's not live, but if you get enough, we can always do that as well.
absolutely. Yeah, we can. That'd be good. All right.
All right.
Well, and thank you for being on again today, and we'll look forward to having you back next month. And until next time, everybody, keep calm and purr on.